Welcome to another episode of Making Rounds at Boca Raton Regional Hospital. I'm your host, Tom Jakarta. We're glad to welcome back Dr. Anthony Lee, who's Medical Director of the Endovascular Program here at the hospital's Lynn Heart and Vascular Institute. Today we're going to be talking about yet another advance that the hospital has recently instituted, and that's drug-eluting stents for the treatment of peripheral artery disease. Dr. Lee, we've all heard about the benefits that drug-eluting stents brought to the treatment of coronary artery disease. Now it's being introduced in the treatment of peripheral artery disease. Let's first give our viewers a definition of what a drug-eluting stent is and how it compares to a conventional just mesh stent.
Tom, this drug-eluting stent in the treatment of peripheral arterial disease is one of the most exciting advances to come about in the recent years. So what is a drug-eluting stent? A drug-eluting stent is a medical device. It's a mesh stent, except on the stent itself, it is coated with a special drug that stays onto the metal, and it is slowly released once the stent is placed within the artery or the blood vessel to prevent scar tissue buildup, which can frequently occur in stents that are not drug-coated.
And in doing so, that the term I believe is restenosis, where once the artery was opened, it closes again and you're back to almost having the original problem that you went in to treat in the first place, correct?
That's exactly correct. That term restenosis is a term that the audience may sometimes hear when they speak to a physician about this, and not infrequently after the initial treatment, after a period of several months or 6 months or up to a year, those same symptoms can recur.
Now, in the cardiac field, we found that the efficacy of drug-eluting stents was significant. I think the early data for drug-eluting stents in the treatment of PAD or peripheral artery disease is as significant in preventing restenosis or having to undergo second procedures. Could you talk a little bit about the preliminary data related to the use of drug-eluting stents in PAD?
Yes. Some of the early data that was available that ultimately led to the FDA approval of this particular drug-eluting stent showed significant reduction in terms of those two main measures pointing to the benefit of drug-eluting stents, meaning prevention of restenosis or recurrent narrowing of the arteries, and reduction of the so-called secondary procedures where the same operator or the physician would have to go back in and open the artery back up. What is very exciting is just very recently, in the last month, I believe, an unpublished presentation had been made out in Europe discussing the 4-year data on this particular stent. And what is remarkable is that the benefits enjoyed by the patient from use of this stent in their arteries goes beyond simply a year, but is extended even up to 4 years.
That's significant.
Yes,
that's significant.
That is absolutely remarkable.
Let's talk about the disease itself. What kind of patient does it manifest itself in? What are some of the contributing factors that leads to the development of PAD? And what are some of the symptoms that someone would have if they indeed have the disease?
Yes, those are all very important points. PAD, like a lot of cardiovascular diseases, is clearly a disease of the elderly. The peak incidence occurs in patients in their 60s and 70s, and it is generally estimated currently approximately 8 to 10 million Americans are afflicted with this disease. A lot of PAD actually is asymptomatic or silent. They also serve as markers or as signposts for coronary artery disease and other cardiovascular disease. There are some well-defined risk factors for formation of a peripheral arterial disease.
Which many are shared with coronary artery disease,
Exactly.
like smoking, hypertension.
Diabetes,
Mm-hmm.
Poor lipid control, sedentary lifestyle, obesity, et cetera, et cetera.
And early on in the disease, much like coronary artery disease, it's very silent.
That's exactly correct.
But will it manifest itself eventually with some kind of symptoms that are notable to the patients themselves?
Yes, exactly correct. The most common symptoms that patients will present with is a condition called intermittent claudication, or known by the acronym IC, intermittent claudication. What that is when a person tries to walk, after a certain distance, the patient will notice some cramping or some painful sensation in their calves, requiring them to stop walking and rest for a period of anywhere from 15, 30 seconds to up to a minute, and then walk again. If these symptoms were to progress, then we would consider that lifestyle limiting, where they can actually conduct activities of daily living, and they should really see a vascular specialist for treatment of that.
And does PAD present with the same risk factors, for example, in coronary artery disease, if you have a blockage or an occlusion, that can lead to heart, the narrowing of the arteries and manifest itself in heart attack. What, beyond the cramping, what are the biggest downsides of PAD?
So there are three different levels or severities of PAD that are recognized, and the condition of intermittent claudication represents the mildest form, and an equivalent for coronary artery disease would be chest pain.
Okay.
Chest pain. Now, what would be the equivalent of a full-blown heart attack, but in the peripheral circulation? That would amount to what we call either rest pain or tissue loss. They represent the two most severe stages of peripheral arterial disease. So rest pain is when an individual simply resting, not walking, in bed, would feel pain in the foot due to insufficient circulation. Now, when that progresses to the next stage of tissue loss, they will actually notice lesions or ulcerations in their toes or in their foot. And that is a harbinger or what we consider a precursor to a major amputation if left untreated.
So this does have significant consequences.
Yes, very serious, very serious.
Much like cardiac treatment of cardiac disease, we are catheter-guided procedure through the groin. Could you explain the procedure itself and how you reach it and how that transpires?
Yes. In the past, the principal method of treating these was a surgical bypass, where we take a piece of vein or even a manufactured plastic tubing to perform a bypass around the blockage.
Again, much like heart.
Yes, that's exactly correct. What is now available, and I think it is safe to say the first line treatment for this therapy is catheter-based, where we actually simply, with a needle puncture in one of the groins, we would advance a catheter or a guide wire, go actually through the blockage, and open the blockage either with a balloon alone or frequently with the placement of a stent. And once again, in going full circle to how our discussion started in terms of drug-eluting stent, that would play a very important role in that treatment.
Now, it's my understanding that Boca Regional is the first hospital in Palm Beach County to be delivering this device and this procedure to all patients who present with PAD. Is that correct?
Yes, that's exactly correct. That's exactly correct. This technology is very new. It was only FDA approved approximately 2 months ago, and like any new technology, the dissemination or release of the technology has been is performed in a very select manner. We are very fortunate at Boca Raton Regional Hospital to be the first and only hospital in Palm Beach County to have access to this new technology for the benefit of the patients.
Dr. Lee, thanks for being with us again here on Making Rounds at Boca Regional. And ladies and gentlemen, thank you for stopping by and learning more about the advances occurring here at our hospital. I think the use of drug-eluting stents in the treatment of peripheral artery disease is yet another example about how this hospital is indeed advancing the boundaries of medicine. We'll see you again soon.